respected chairpersons, and my dear friends. Most of us spent considerable amount of time in talking about lifestyle. Maybe bulk of the time we spend with the patient is on lifestyle. But it is frustrating often when much of the advice we give, I think only very small, minuscule component of our advice is followed. There could be many reasons. Part of this blame should be on us. We don't consider the patient's habits and traditions, not concentrating on the eating pattern rather than individual component of the food, and not very specific on our recommendation, and not understanding that changing is difficult for everybody. And one point which I always thought that we concentrate on don'ts. Instead, I think if we concentrate on do's, I think we'll be more effective. So these are the 5, 7, 8 areas which I will be touching upon, and maybe everything has to be very brief. But exercise, we all know, after post-coronary heart disease, either post-ACS or chronic coronary syndrome, it is extremely important. And the recommendations are very clear. Moderate intensity exercise, at least 150 minutes a week, or vigorous intensity exercise, 75 minutes a week. And then a little bit resistance exercise, at least twice a week. Now, how to bring about it? How do you assess the moderate intensity based upon the target heart rate? Or you can do simple talk test. If you can speak comfortably but slight breathlessness, you are doing moderate intensity. And if you cannot speak only sentences but only 1 or 2 words during the exercise, you can consider this as vigorous intensity. But there are other methods also. But exercise alone is not enough. But because people now think that you do exercise for 30 minutes and that is it. And then rest of the time you spend in front of the television or sit quietly. That is not right. Sitting is the new smoking. So you reduce the sedentary time, and I think you need to, what I advise my patient is every half an hour of watching TV or anything, you just walk around for 5 minutes. That will prevent the sitting menace. And then my patients always say that I cannot walk because I have knee pain. I cannot walk because there are dogs, street dogs. So all this we have to have ready answers. And the only way is to find out the alternative to all these complaints. Now, the resistance exercise, I think, is very important because strengthening the core is important. You can suggest calisthenics. I can use water bottles as dumbbells. So many things can be prescribed. This is the pursuit. So, the studies have shown that if you do a exercise-based cardiac rehabilitation in post-MI, it improves the events and improves the cardiovascular mortality. Second point is about weight reduction, and you have to tell the patient what is the ideal body weight. And how do you find out the ideal body weight? I use the BMI figure of 22 as ideal because normal weight is between 18 to 22.9 for Indians, but I think roughly a 22 BMI. So I ask the height in meters into height into meters into 22 will be the ideal body weight. And if you can permit around 10% excess over this ideal body weight, but anything excess, I think we have to suggest that. How do you reduce the body weight? You have the simple old calorie counting method, which I think is very difficult and not very practical. The other 3 methods are the low carbohydrate diet, the time restricted eating, and a combination. I think all the 3 combination probably is good because what we have found that our carbohydrate intake is around the tune of 79 to 80%. And the recommended Indian guidelines recommend a carbohydrate intake of 40 to 60%. And so I think the carbohydrate intake is a number 1 culprit in our country. So I think we will have to advise our patients to reduce the carbohydrate. And then even if it is substituted by fat, it doesn't matter. And time restricted eating is coming in a big way, that you restrict your the eating time to only 10 hours a day. So you start suppose you start your first meal at 10 o'clock, then you can continue to take it until 8 o'clock. If it starts your breakfast at 8 o'clock, then after 6 o'clock you should stop eating altogether. So 10 hour, and then intermittent fasting. So all these different combinations you have to advise the patient depending upon the type of patient you have. Then the diet. Now we have, it is a main component, and it's a very controversial area. But I think it is better to stress on the non-controversial area, there are areas which are proven beyond doubt that it is beneficial for the heart. So concentrate on the non-controversial. So eating 3 servings of fruit, 1 serving is 1 robusta, or 3 servings of fruit, and 3 servings of non-starch vegetables. It is non-controversial, proven. Lot of trials. But what is our results? What we did, the low fruit intake, or the study in the CSI Kerala CRP study, we did in Trichy, Calicut and Trivandrum. What we found that less than 1 fruit serving per day, that was in 70-75% of our population, they take less than 1 fruit per day. Vegetable fruit intake, again in our study, the less than 2 serving of vegetable plus fruits, that is around significant percentage of our patients are not. So they are not following the diet. So you have to tell them that is important. Okay. Eating legumes, pulses, at least 1 serving per day, no controversy. It is beneficial. And if you are a vegetarian, you have to double it or triple it. Legumes. Nuts and seeds, no controversy. All the nuts and seeds, especially cashew nuts, almonds, they are rich in monounsaturated fatty acid. And now we know that a significant amount of vegetarian plant-derived monounsaturated fatty acids are good. So recommend your patient with CAD to take, no controversy there. Then there is no controversy on the benefits of yogurt, dietary fiber, liberal potassium intake in the form of fruits and other things. Moderate alcohol use, there is generally there is no controversy. It is beneficial if we can stick to a moderate. We will come to that. The Mediterranean style of food. I think the only randomized controlled trial in secondary prevention which proved that there is a reduction in the event is the Leonhardt trial, and for the Mediterranean. So we have to think how our Kerala diet can be modified to a Mediterranean diet. The Mediterranean diet is actually rich in vegetables, fruits, and nuts and seeds, and also monounsaturated fatty acid in the form of olive oil and fish and poultry a little bit, not much dairy and no red meat. So I think this is the diet which I think we can easily adopt in the Kerala model, because the vegetarian, non-vegetarian Kerala pattern is almost similar to, or we can make it similar to a Mediterranean diet by increasing the fish intake, reducing the carbohydrate, and increasing the fat intake, because the Mediterranean diet is rich in fat, 30% fat. So you have to, instead of our old advice to our CAD patients, no fat, porichadum, varthadum, kaikkaruthu, that immediately antagonize the patient. It is not required, because fat is not harmful. Total saturated fat, there is some controversy, but total fat can be 30%. And in the average Kerala diet or Indian diet, the fat is 11%, and in Kerala diet is 17%. So I think, so our patients will be more amenable to our suggestion. The Leonhardt trial, I don't want to go into detail. 73% reduction in the event rate in people who followed the Mediterranean diet. And there is no controversy about the harm of the partially hydrogenated oil, dalda, and vanaspati. No controversy about processed meat. No controversy about sugar sweetened beverages, food rich in refined grains, added sugar, no controversy. And there is no controversy actually that total fat is not harmful. So many number of studies. I mean, initially people said no fat, restrict the fat, restrict the fat. And the belief that if you reduce the fat, you can reduce the weight. But that is not so. If you reduce the fat too much, you will take more carbohydrate. And more carbohydrate has the capability of not giving you satiety. So problem is people keep on gaining weight on a very high carbohydrate diet. So all the recommended guidelines recommendation have been changed now. Low fat diet has no benefit. Trials have shown this. So we need to change the fat recommendation. Indian guidelines have already changed. The Indian guidelines say fat 20 to 30%. This is the status. Okay. I think it's 1 minute. The other thing is the dietary cholesterol controversy. I think we know that we have been restricting people not to take eggs, but I advise patients to take eggs daily because that is the cheapest protein available. And there are empty number of studies which show that each egg contains 200 milligram of cholesterol. But 3 eggs, even studies which showed that daily consumption of 2 eggs, the LDL cholesterol, the total cholesterol elevation is 4 milligram. And the HDL cholesterol is also equally elevated. So I think we should stop recommending patients not to take eggs. Then cholesterol is so many things which eggs I think we can again salt I think the standard recommendation is 2300 milligrams sodium, which is converted to 6 gram of sodium, which is I think reasonable. Too much restriction of sodium is not recommended now unless you have resistant hypertension. Smoking cessation, I think we should spend time because that's after the CAD event, there's an ideal time to stop smoking. And you should concentrate on the 5 A's. Ask the patient whether he's smoking, advise the need to stop smoking, assess his willingness to quit smoking. Fourthly, assist by asking him to make a quit attempt and then arrange a follow-up. If he's willing to quit, set a quit date. I think I found it very useful. Setting up a quit date is very important. Okay. Alcohol, I think it is beneficial, generally considered to be beneficial if it is a moderate alcohol intake. But that is not very practical in Kerala and India because people don't restrict the alcohol intake. And the Interheart study showed that everywhere, all over the world, alcohol is protective except in India. So in India, when you are practicing in India, I think it's better to tell patient not to take alcohol. Then sleep is very important now, which is grossly ignored. But the recommendation that AHA recommendation of the life symbol 7, they made it life symbol 8 by adding that adequate sleep is essential for good cardiovascular health. And yoga and meditation, we have studies now which shows that it improves the quality of life and maybe it improves the cardiovascular risk factors. And longer studies actually later on may show a benefit in cardiovascular mortality as well. So thank you very much.
Thank you, sir, for a great talk. Actually, this is one of the most controversial area for getting a talk and finishing it off in a real-time manner. So my doubts are actually, sir, in the sense how we will manage these patients in a clinical basis. That is, suppose a patient is coming with CAD and the advice given by you, what is your practical viewpoint? In the sense, what is your personal viewpoint?
During the COVID time, my wife was hearing whatever I was talking to my patients. And she said that you are getting angry when you're talking to the, I think all of us must be facing the same, because the doors or windows are open, so she can hear whatever I was talking to the patient, and I was talking loudly and with the anger. I think that is not probably the solution. So I solved the solution problem by printing whatever I want to tell the patient as a form of a booklet, which I have printed, which is not the booklet by the dietitian, because the dietitian printed the booklet. If you read it, the patient will say, okay, this is not the diet for me, I will not use it. But this is a diet booklet which I made myself, which is patient friendly. And why I tell the patient? I tell the patient that eat red meat, beef or mutton twice a month. Eat fish twice a week, twice a day. Eat chicken twice a week, and eat egg daily. and vegetables and fruits to your heart's content. Pulses at least once a day. And vegetarians, they are omega-3 deficient, so they have to do something. I think the only way to get omega-3 for a vegetarian will be using a lot of fenugreek and mustard. So I think we should advise them to eat mustard and fenugreek, otherwise they will not have omega-3. And non-vegetarian, no problem. Eat fish too. Fried fish is okay. That is my take. So because of fry, we have been saying no fry. No, but what is the harm? Your fat intake is already very low. So your fish contain lot of omega-3. And in the normal heating process, the omega-3 is not destroyed. So I think what is the harm in using a light frying your fish, which is so tasty and also so desired by our patients. But then we have been telling from years to years, don't do it. And that is antagonizing our patients.
Thank you. Sir, actually you can see the passion with which sir is talking. Otherwise it's such a tough topic, really boring topic. Because it's the easiest thing for a practitioner is to start on pharmacological therapy. And the most difficult part of a practitioner is to change the lifestyle of the patient. And the life, very complex thing. It's not a simple thing. And people needs rewards for taking the stress of life. That is the pleasure in life. The most important pleasure in majority of the people is food, sex, and certain habits they cultivate to derive pleasure. Smoking, alcohol, marijuana, drugs. So we cannot deny the pleasure of life. Otherwise, what is the meaning of continuing living and taking the stress of the everyday life? So it's a delicate balance. What do you think, sir?
I think we have harmed a large number of our patients for the past so many years.
Absolutely.
Cardiologists have been guilty in many ways.
Sir, 3-4 things needs a clarification. One is the time restricted eating you have said. We have to give at least 12 hours of fasting every day. That may be the best thing. Second is the protein intake, which is so low, because any person who work out will find that to get 1 gram per kilogram body weight protein intake in an average Indian diet, so difficult to achieve unless you take a protein powder. What do you think, sir?
Agreed. Well, so that is why I said eat 2 eggs per day. But no harm.
Pulses.
Because the dietary cholesterol is not going to elevate the total cholesterol significantly. That is the result, because these are all pre-statin. Look at the coconut oil study from Amrita. What they found was, you know the study,
yes, sir.
that secondary prevention post-MI survivors, they tried coconut oil versus
Other oils.
Sunflower oil. And no difference in the LDL cholesterol.
And actually there was
the
some
reason was all of them were on statin.
Statin.
So when they are already on a statin, why restrict the patient the pleasure of, if they like an omelette, do an omelette every day?
What about a diet holiday? If I'm taking a restricted diet and very tight diet restriction for 6 days, and I'm coming for a conference. So why don't I take a diet holiday?
No, all of us are doing it, but we are asking the patient not to do it.
Not to do it. And what about, sir, using the gymnasium and workout for a patient who had a CAD?
I think because that's a very valid point. When they should do, because the problem is not accessible to most of our patients. But I think strengthening the core muscles. I think apart from the 20, 30 minutes prescribed aerobic exercise, I think now all the guidelines are saying that we should promote resistance exercise. And resistance exercise can be done at home. You can do a couple of squatting, plank exercise, and at least use the water bottle as a dumbbell. So all this you can advise your patient, and the patient will thank you.
And now another concept that is coming up is the sleep health, the aspects of the healthy sleep. So that's also important. At least 6 hours is the current concept. Current concept is 6 hours. And
And the soleus push-ups, you heard about
Yeah.
that? No. Recently, one or two articles, soleus, I mean, while sitting quietly, I was doing that, all of us must be getting bored and all. You just, by sitting, keeping both your foot down, just lift your heel periodically. Lift it and leave it. And keep on doing it when especially you can do it when you are listening to a talk. and
Attitude,
and,
I think-
people have found that
Prevent sleep also.
metabolic exercise is the benefits are very high.
And the final thing that is remaining is the sex life of a coronary artery disease patient. You didn't mention.
Okay. No, it's a big area.
Because I still remember the
That
talk
is
in
what,
CSI of sex in coronary artery, sex life of coronary
I
artery
think
disease
the,
patient.
unless we, in our interview with the patient, unless we bring this up, the patient, most of the patient will not bring it up. And even though that is what they say when they are fatigued, the clue is they will say, I am doctor, I am feeling very tired. So that means that he probably wants an advice regarding this. And we ask them, the energy involved in doing a sexual act is climbing one flight of stairs. And I think if he can comfortably climb one flight of stairs, he can endure and there is no risk of sudden death after a sexual activity in our post-MI is very, very low and negligible.
That is a sex with your legal partner that is specifically mentioned.
Right. Thank you.
No, that is a scientific fact. I think if the, sir, Manjaran sir, you wanted to say something? Because I saw you noting down something.
As you rightly said, the food items which have been shown to improve the life expectancy are actually the nuts and fruits. These are the two items which have been shown to improve the life expectancy. Vegetables are actually, I thought it can also increase the life expectancy, but it is neutral. These are the two items which have been shown to improve the life
That is
expectancy.
because the vegetables have been clumped together with the starchy vegetable and non-starchy vegetable. Because there was
That I have
some
not
mix-up.
differentiated, but
But
vegetables
now I
have...
think they said that starchy vegetables will have a problem. Potatoes, they are also included in the vegetable classification.
The classification is this way. I like to know that trans fat is something which is been shown to be very bad. Trans fat.
Trans fat. Oh yes, so I have probably.
So trans fat, actually the two food items which are very rich in trans fat are one, the preserved food, two, the fried items.
Pardon?
The fried items.
Yes.
Fried food. The fried food as well as the preserved food are the two food items which contains a lot of trans fat. So
That's
your
right.
concept that, so I would like to have your explanation. You are telling that the fried items are no problems. I find that is against my concept. I would like to have an explanation because trans fat is known to have high content of fried items have been shown to have high content of trans fat, which is bad.
No, I agree that during the frying process, if there is some trans fats are formed, but the quantity of trans fat formed during a normal frying is probably not very high. Mainly trans fats are formed by using the partially hydrogenated oils, dalda and vanaspati, which are always very rampantly used in biscuits. And our patients religiously avoid sugar, but along with the bed coffee, the practice at least in Trichur is to take a biscuit or two biscuits or a rusk. And all these are all empty calories and it contains trans fat. Secondly, when you are asking biryani, which is very rich in trans fat, So I advise my patient not to eat biryani from outside, but if you want biryani, cook it yourself and without using dalda. Regarding the frying process, the issue raised by, I think, to my mind, because even olive oil can be used for the tawa frying, because olive oil is supposed to have a low smoke point, 370 or so. But even then, in the cooking process of Mediterranean countries, they are using the low heat frying, the tawa frying. When tawa frying can be, that is what generally recommended frying method. The deep frying, now I think it is not very commonly used in Kerala also.
Frying, I would recommend coconut oil.
Pardon?
For frying, I would recommend coconut oil.
I agree.
Because
That
this
is
the
deep
one-
frying.
Yeah, this is the oil which will have minimum transformation.
Minimum?
Transformation.
Okay, that is because all the saturated fats,
Yes.
they don't get.
Yes. So,
but
other oils are more likely to transform compared to coconut oil.
that is, but
for-
even the transformation of trans fat happens in a very deep, very high heat, and not in the ordinary
But there
heat.
is some conversion, but I agree with you that it is in very high heat that there is large quantity of transformation.
That.
Sir, I think the transformation is more when you reuse the oil.
That is
Reuse
more.
the oil.
That
Because
is-
in hotels and all, very often it's reused.
The reuse, the problem is the oil is already transformed. See, it is in the first use, it is already transformed and then you are adding on to it. That is the problem.
Sir, can we have a take-home message for the physicians that let's not take away the pleasures of life of the patient from the 5 patients, but it should not be an indisciplined life.
No, the problem is, I think you use your own, don't use the diet sheet given by the dietitian when you are dealing with your patient. You talk to the patient about his desires, and considering that food is an important thing for him. So I think you have to align to the patient's food habits and then make suitable changes slowly instead of, I think, aggressively saying too many don'ts. Thank you.
A satisfied life makes you to live longer.
What, sir?
A satisfied life
Satisfied.
makes you live longer rather than a restricted life, which may be according to the health directive, that may be the correct thing. But it is the satisfied life which makes you live longer.
So the final message is from Dr. Manjaran sir. A satisfied life makes life longer.
So let's be all contented with what we have. Thank you, sir. So, sir made that topic very, very, what do you call it, quite interesting and exciting.